whole healthcare industry is going to change dramatically in the next couple of years.
To chronic disease management and the preventative aspect of care.
AI can now understand the key clinical concepts of what's being verbalized in healthcare.
Welcome to Cherry Live. I'm Dr. Jordan Valrath, physician, entrepreneur, and Chief Medical Officer for Cherry Health. We're talking about Canadian healthcare. Join us as we speak to innovators, industry leaders, and people working to drive the health system forward. All right, today we're talking to Dr. Keshav Sharma, family medicine physician and close personal friend of mine. So Dr. Sharma completed his medical studies at the University of Alberta, followed by a rural family medicine residency in southern Alberta. He has practiced across multiple provinces and territories and has now decided to settle down here in Calgary. Thank you for joining us, Dr. Sharma.
Thanks for having me, Jordan. I appreciate it. This is definitely a new experience. I'm looking forward to it.
Okay, so why don't we start off sort of with just your career trajectory in general? I find you very interesting in sort of what you've decided to do with your life, and being a young man who's been in practice for 6 years now, you've had a variety of jobs across the board.
Yeah, I guess when you mention it like that, 6 years, I still go back to our days at the U of A there and kind of just seems like it was yesterday. But yeah, kind of from my whole career perspective, going back, I grew up in a rural area in Lloyd. So that was always kind of my inkling when I wanted to get into medicine. I always had exposure to great doctors that seemed to have like a wide breadth of skills. It was really interesting growing up Indian in those areas too. Like we had seeing people that looked like me in kind of positions that demanded a lot of respect, whereas I might not have been getting that same kind of respect as a child growing up in a place like Lloydminster. So it's kind of cool to see that you can make it out and you can aspire to be something. And seeing that doctor that took care of our family from when we were young, he'd come over, do house visits, and he would always seem to remember everything about you, and that kind of lit the fire on me to be kind of go down the path of medicine. So that's kind of how we went all the way down this route. And of course, going to U of A for medical school, there's a lot of different things that kind of were presented in front of you, and I kind of drifted a little bit away from family medicine. Everyone wants to be the surgeon, kind of go in ortho. Then all of a sudden, I think everyone has like that crush on emerge or anesthesia as well. And kind of going through residency, but ended up having an amazing rural family medicine rotation back home. And at the end of my fourth year, just kind of going through the hoops to go to any other specialties, I was just like, man, family doctors seem like the happiest people out there. They seem to really have that thing they call work-life balance. And yeah, I think, that was kind of the path that took me down to family medicine for sure.
So did your training, went down the rural family medicine route. 6 years later, here we are practicing zero bread and butter classic family medicine. And you've had like several different, I don't know if I'd call them midlife crises on the way of like full on pivots in your career. So you started doing rural medicine. That lasted for a little while. And then you did your did you do your sports med before you started doing rural medicine as a locum?
Well, you actually missed 2 jobs in between there. So it started off with kind of rural family medicine. So I had a really great kind of practicum in my last year residency, and I was able to just kind of do some locum, kind of taking over one of my preceptors who was moving to a different small community. So it was a pretty seamless integration back into the community I was working in. And it was honestly like an awesome setting. I had access to like a lot of my preceptors, and, I made a lot of those first kind of overnight emerge shifts that got a little bit hairy, always knowing that I had backup, and a lot of them would help me out by being like, hey, I'm going to be around town this weekend. So, when you're doing your first 48 hours by yourself, you can always call a friend. So having that support was really astronomical and really quite great. At that point, I was kind of in my own personal life. I was single, so I didn't really have those opportunities kind of waiting for me in the small town. So I made the decision to kind of continue doing some locums closer in the Calgary area, initially in Airdrie, and then I was also going up back and forth with Yellowknife for a short period of time there too. So kind of getting a little different view of our country, kind of seeing what rural medicine is like up north. which gave me a nice little taste of that as well. And then kind of pre 2020, that was also kind of my first foray. I remember seeing an advertisement for TELUS Health, kind of the Babylon, which you may be familiar with, of course. And yeah, I was one of the first doctors to kind of get on that before everything that blew up with COVID, and thought that would be kind of the future of medicine, moving a little bit more in that direction. And when I made the decision to kind of quit doing my locums and kind of settle down in the Calgary area, it was mostly leaning towards joining sports medicine. A good friend of mine actually was currently doing his fellowship, and he put me in touch with one of his preceptors that were doing sports medicine in the Airdrie area, and they helped me out and said, hey, like if you come work at our clinic, we can kind of do a little like mini residency for you. We'll get you some hours doing some sports, some events, working with some of the teams, and yeah, things are going pretty great. And then COVID hit, and things kind of really took a turn.
So virtual care, and then how long did you actually like spend in the sports medicine side of things?
So on the sports medicine side of things, so I guess, yeah, I would have started just in I want to say about kind of 2019, late 2019 sounds about right. So kind of going there. And then I think I gave up sports medicine towards the end of 2022.
So you got a couple years out of that one. What was unsustainable about that? What was the issue there?
Yeah, I think sports medicine really kind of was awesome. And, and let me tell you kind of how I got to that point as well, too, going through my training with family medicine. I mean, while there were certain factors that were really wonderful, I mean, there was definitely a lot of workload. Rural family medicine in particular was quite demanding. But, there was so many things that I told myself that like, I just can't sacrifice this stuff. Like I need to have a life as well too. And when you're a young physician, single, in your mind, you say like, well, I don't have anything better going on. I got to work. I got to do this stuff here. And so when I made the decision to leave rural, I said, oh, better do family medicine. And, I kind of kept having that in the back of my mind saying like, oh yeah, you like this. This is fun. Keep going. This is great. Just keep working. And there's this little kind of subconscious voice being like, oh, okay, you got to keep doing more here. You can't just not understanding that, maybe this career wasn't necessarily what I wanted to do, or I was struggling with the idea of being like, this is going to be my one clinic. I'm going to settle down forever and I'm going to be the community family doctor. I started kind of veering into a little bit of saying like, I need something else to kind of clear my mind. And sports medicine, just kind of the story of my career. I had a friend that popped by and said, hey, like, have you ever thought about doing this? This might be something you're interested in. And it really did blend my passion for just physical activity sports outside of my career. And, it was always something I did pretty well in my rotations, ortho. I did many sports medicine electives. So it seemed like the logical switch. But unfortunately, it was great pre-COVID. And once we got into COVID, things really changed up quite a bit, in particular with a lot of the teams that we were following, high school teams, high school sports, junior athletes, those all but came to an end. So, that motivation I had initially when we were doing it, I felt like I was a resident again. I'd come home after work, I would be reading up on my cases, we would be doing rounds with our team. And it was really, really fun. And it kind of got to the point coming closer to 2022, when things weren't really changing and I was feeling a little bit of that burnout, constantly working, that my coworkers, they kind of noticed that something had kind of changed. I wasn't really myself again, and I wasn't quite putting the effort or focus that I previously had. And they actually took me aside and said, hey man, like, what's going on? Really? Are you okay? Yeah. And it was, how it is, kind of being a male, being in medicine, you just got to be like, oh, no, I'm fine, man. It's just totally what it is. And yeah, they had a real honest talk with me too, being like, hey, like, I want to bring up some of the cases, some of the patients that you saw, and like some of their feedback, some of their therapists' feedback on you. And, things in my mind, I was just like, oh, that was okay. It was good. Like, it was fine. They're kind of reading back to me some of this stuff. And I was just like, what? Like, I did that? Like, that's not right. Like, I didn't do that. Did I do that? And yeah, like I had a lot of friends at that clinic, and they're still good friends of mine till today. We still chat, but they're like, yeah, man, like something's not quite right with you there. So I got to the point there where I really had to have a good think about like my career, and we did like a little. They're like, hey man, like, so why don't we give it a good go for like a month? Why don't you come back, work at the original clinic up here and see how things are, and let's reevaluate what your thoughts are if you want to continue with this. And honestly, after a week and just really kind of self-evaluating, it kind of had that realization again that I was just like, you're just doing this because, you have to be a doctor, and you have to, in your own mind, have to be something above and beyond just a general practitioner, as terrible as that sounds. And, it was a really kind of earth-shattering moment for me. And I went through it for about a week, and I went to them and I said, hey guys, I really appreciate the opportunity, but I don't know if I can do this, let alone even continue in medicine. Honestly, I was really kind of at a low of a low, and they helped me kind of get help, and working with psychologists, kind of reevaluating and just kind of taking better care of my mental and my physical health during those times. And coincidentally, through that job, I was introduced to obesity medicine as something just to do on the side as well. And initially I thought like, okay, this will kind of pique my interest, keep me afloat here. It sounds pretty cool. And honestly, that was one of the best decisions I ever made, because, that was kind of that window in medicine. That was everything that I thought family medicine was going to be, really focusing on prevention, really having that multidisciplinary team, kind of working with patients, and just being able to kind of figuratively put out some of those little bushfires, things that can cause like metabolic syndrome. They're slowly creeping up lipids, their blood sugars just kind of being a little dysregulated. I kind of found that in obesity medicine, and that really preventative aspect. So through something I would have considered a failure, I know I could have just done exactly what I did with sports medicine, and really just like put on a strong face and just really buck down like you do on all those really tough rotations or things you just don't like doing in your training. And I was fortunate just to say like, hey, like, I don't think this is for me. And then just kind of went with the wind, and it actually happened to work out pretty well.
So you started out with core bread and butter family medicine. Burnout was setting in early, switched over to the sports med side of things. Same feeling, to the point that you got called out by a colleague of like, man, we're worried about
Absolutely.
you. How are you feeling? And then, so you're like, okay, realization number 2, I'm still burnt out. I got to switch. And then now you've done your ABOM, your American Board of Obesity Medicine. And so now you're on your like second subspecialty, I guess, out of 3. We haven't discussed the other one yet. I mean, now that you're doing the obesity medicine, why aren't you burnt out here? Is there something inherently different about this subspecialty? Why is that any different from that perspective?
I think the thing with obesity medicine that just is a little bit different is, it's such a new and kind of burgeoning field, right? And as we know, like obesity is a very complex issue, and it's one of those areas, my area in particular, kind of medical nutrition therapy. There's millions of studies that are just all around there, and you have to kind of interpret the data and apply that data to people. And there's not really that typical like guideline. If you refer to the Canadian guidelines on obesity management, they're just like, obesity is a complex multifactorial disease, and it's very complicated. Here are some things to address, and it's like a million different things on there, right? So I feel this is a field that in 10, 15, 20 years, this is going to be kind of the next up and coming field, because I don't think there's an area in medicine that can really touch in so many different domains in patients' health and well-being. So I think just getting in on that early and just kind of constantly being introduced to other people throughout the country that are really, really interested and knowledgeable about the field of obesity is really cool to just be a part of. And it's something that's always fresh and interesting for sure.
This show is brought to you by Cherry Health, Canada's medical network where healthcare practitioners connect. Physicians, pharmacists, nurses, chiropractors, and all other healthcare professionals can sign up for free, start connecting, messaging with colleagues, or checking out job opportunities posted by thousands of employers across Canada. With dozens of healthcare-specific job filters and search options, we make it easy to advance your career, Find your dream job or line up your next locum with hundreds of new jobs posted every week. www.cherry.health to get connected today. So the passion for it shines through. Is that like the one missing piece that was making you feel burnt out before? Is that love of the game? And now that that's been changed, that makes all the difference? Or is there like a work-life balance component to it, or that sense of duty of just needing to take more and more and more patients? Or how do you find that you're balancing that now in the obesity space?
Yeah, that's a pretty good question. And in my mind, I think I can't speak for other people, but I know for myself that, to be practicing medicine is obviously a great privilege. And, sometimes we tell ourselves that, like we have to put ourselves through a lot of this stuff, and we might be doing things just kind of on that unconscious level that, like we just got to do this. We got to put our head down, get through it. And you don't necessarily love what you're doing. You might like it. You might say it's okay. I can manage this. And we might justify it by saying like, at least the money's good. Um, but I realized pretty quickly, and especially with my switching my job up kind of on multiple occasions, being like, it quickly switched from like, oh, I failed at that job. Oh, I wasn't good enough to do that job. Oh, I'm never going to be able to do that. To quickly learning, being like, hey, like you're listening to your feelings, you're listening to your insight. Like the spark's not really there. Like you don't have to settle for doing something that you don't love, or you don't find you're not passionate about. It's something, there's something out there. And I think that was definitely one component, being like, reframing those kind of those career changes into kind of more as the next logical progression to finding your true passion. And
Yeah.
again, in a field like medicine, everybody can find a passion there. They just might not necessarily be there right now. And yeah, I think kind of taking it to the next step too, what really kind of reframed that is, I think obesity medicine is an amazing topic, but working at a clinic that's really innovative and not really like any other clinic that's out there, like my current clinic, has really kind of changed things up as well too. So that was definitely a big selling point, kind of giving me that symbol that you're in the right path and it's a joy to go to work every day.
And so personally, I've had numerous different jobs within family medicine. Very few of them actually core bread and butter family practice. It's all over the place, right? Rural practice, virtual practice, running a tech company. Like, are we the odd ones out here, or is this like pretty standard just for family physicians in general, like testing the field out and seeing what's out there?
Man, like we got those commitment issues for sure. It's I don't know, this kind of I always have this question now, and like my partner, she's a nurse by background, but kind of more in that public health, has worked in international kind of health systems and kind of seen little different pieces. We had this discussion. Um, do we really kind of our society seems to really value those people that are like, they worked one job for 25 years and they have so much experience in this one range. And I could definitely see the utility of that. I think in medicine, that's also something that's really, really applauded and rewarded. Um, but I feel at the same time, to change it up and to take ideas from previous clinics you might have worked at, or previous patient populations you worked at, previous administrative tasks that you've had. I think there definitely is a plus to working a broad array of jobs, right? And I think the younger generation is definitely of up and coming doctors are really open to the ideas of locuming and maybe not necessarily committing right off the bat to one job for the rest of their life.
Yeah, we didn't even really chat about the part where you're doing mental health and that side
Oh
of
yeah.
things sort of as another subspecialty, but maybe it is sort of a generational thing, right? You looked at like our grandparents' generation and they would like start and end a 45-year career at the same company and they would just be there forever. But now you look on people's resumes, like a 5-year tenure is practically forever. Like it's just shifted completely to couple years. 3 years is a pretty good stint at a company. Looking at a lot of resumes, 5 is like rare, and then beyond
Yeah.
that is just unheard of almost, right? So maybe that's just something to do with our generation now. We're hopping around more.
that ADHD generation, right? We often kind of have that short attention span, and I don't know. I mean, I look at it. I really did enjoy my training going through like medical school residency, and it was honestly until kind of just thinking about what I wanted to even talk about on this podcast, it kind of hit me. I was just like, oh yeah, like you're kind of in love with exploring different branches, and to me that was kind of leading me more towards general medicine off the bat because every day is a little bit different. There's always something different. But I realized that I kind of like the idea of being like, hey, like for 4 months you're going to be on internal medicine, and then for 2 months you're going to be on pediatrics, and then 2 months you're going to be on general surgery. Like I realized that's kind of what I really enjoyed about my training. So it's kind of weird that you have to make this decision to say, hey, like this is what you're doing for the rest of your life, and that's it. Enjoy. And that's a really tough decision, I think, not only from a medical aspect, but for anybody to just say like, this is it. This is the rest of my life. So for me, I found that was like a tough choice to make. And we have this podcast a couple years down the road. I don't know how many more jobs I might add on that list.
I don't even want to venture a guess at that one. Maybe it's just a matter of having a side project or like a part-time thing, like a bit of a varied practice, I guess is what it comes down to. Like having multiple things on the go. Now it's keeping it fresh. You don't feel as constrained, I guess. I don't know. I mean, right now you're doing what, half and half, obesity medicine and mental health, or what's it actually like recently?
Yeah, it's kind of 4 to 5 days a week usually, and just kind of protecting a little bit of that time for yourself to catch up on charting that work-life balance there. But yeah, it's about a 60-40 split right now with mental health and obesity medicine right now, and kind of introducing that mental health was really nice in the sense that I was given a really cool opportunity. I found on Cherry Health, of course, and yeah, a cool opportunity to work with a really interesting population, student health, and that was kind of the area where I knew, like, I feel, I've always kind of just tried to pick areas where I can make kind of have the largest effect on a population. And there's certain places, I think in like early childhood is obviously one of those areas. So pediatricians and pediatric specialists can really make those changes. But I think another really pivotal area to make some changes for the better are in the university kind of adolescent age population. And I really do enjoy the task of kind of sometimes being the first doctor people even see or open up about their mental health with, and try to help them get the proper diagnosis, help them with a little bit of counseling, CBT, motivational interviewing. And I think that's a really, really special kind of perspective I get to try to help them kind of make their way through the healthcare system for the rest of their life. So it's a really cool job to kind of fall into coincidentally.
Yeah, same wavelength. Like I've really been enjoying my practice in the mental health space. Like I find it very rewarding and sort of it's fun, right? Because you get to use your people skills and your conversational skills, which is something that not every physician graduates with. And so I do find that sort of a unique area where you have value to add as well. I imagine similar on your end.
Totally. Yeah, absolutely. And I can't speak for anyone else, but I know it was one of those things I never really loved. It definitely wasn't like the sexy area during your medical school or residency. I remember our rotations were just like, yeah, show up, just say hi to the patient, and yeah, you're home at 12 o'clock and enjoy your life. But like, definitely not something I think I'd be able to do for the rest of my life. But yeah, I think, when I was in my family medicine rotation, or family medicine practice, that was kind of the intervention. I started realizing that if we could just give these people a little bit more of our time, which was kind of so precious in the clinical setting, that maybe we can start to kind of break down like, okay, why are you having the stomach upset, or why are you kind of no longer talking to your friends? What's going on with that? But sometimes in that 10-minute visit, like you can't even scratch the surface. So just having the privilege to have the time to sit down and talk with people and take like a thorough history is actually super rewarding. I don't know if that's kind of your experience as well, or kind of how you enjoy that working.
Well, thinking back to medical, like I went into medical school not knowing what I wanted to do, but I was certain I didn't want to be a family doctor. That was like the one fact I knew to be true. And here we are. So it was like, as a kid, my only experience ever going to a family doctor is when you got a wart at the swimming pool. Then you'd have to go back and they'd cryotherapy it, and it was awful. And then so that's what I pictured family medicine was like pre-med in my science degree. I was like, okay, it's just dealing with warts. And as a bit of a germaphobe, I was like, I don't want to do that. That sounds terrible. But then you get into your actual clinical rotations, and it was like, oh, this is actually really cool. There's a lot of stuff going on here, and it was really, really interesting. And so then by the time you get through medical school, it was, okay, I want to be a family doctor. Actually, and an ER doctor. Those were like the two number one things on the plate. And then wound up doing family med and worked in a bunch of ERs, did a lot of rural work. And it was really awesome. It was really fun. But then, of course, wound up chasing the tech world, right? And going down the entrepreneur route. Sort of, for me, it wasn't really that there was something that I didn't like about family medicine. It just was kind of this window of opportunity that I kept going down. I don't know, was there anything like magnetically pushing you away from the family medicine field as you went through your career? Like, why did that suddenly, the bread and butter family practice clinic, fall off the table?
I think I know obviously right now things are a little bit more magnified here in Alberta, kind of post-COVID and things like that. But I mean, I also realized that, things weren't great even pre-COVID, right? I think COVID really revealed a lot of those kind of glaring holes there. But that was kind of something that was always on my mind as well too, was just like, it's a big ask to just kind of say like, hey, I'm going to settle down in this community and this is where I'm going to stay. Because, I think doing family medicine, you really, and this is something I don't think I've gotten in any other kind of career that I've had since, is you get that connection that you can only get in family medicine, that, you're seeing them for sometimes cradle to the grave kind of thing, right? Your panel is 0 to 99 years old, and you're able to do so many more procedures. You're the one kind of clearing off these forms, all the WCB stuff. As annoying as it was, it's kind of cool to be the person that kind of can help get them back to work, or you can vouch for them, and your word actually has some meaning to your word has some weight to it. But yeah, I think I just felt so guilty that, if I couldn't commit to this practice for almost the rest of my life, like what if things changed and I had to move, I'd feel so guilty just abandoning these people. And, just having those thoughts and saying like, yeah, I just wouldn't feel right just kind of working people up in a certain way and then abandoning them. So that was something that really kind of started pushing me away to something that I could kind of still help people out. But, I also wanted to make sure they had somebody that they could probably go back to, and family doctors that were able to kind of spend the long term with them and able to commit to that. So that was kind of my reasoning why I kind of started pushing away from family medicine a little bit.
It's interesting that the expectation itself is thwarting people from going into it, right? Just that sense of permanency, and like you're getting married to your patients, right? And the guilt that would follow if you had to break up with them, I guess, so to speak, right? And just the medical legal ramifications of like closing those charts and like responsibility for those patients, right? But yet it's like actively dissuading people from going into it. Maybe they would have gone, and maybe you would have done more of it if you didn't feel that like such a sense of everlasting permanency with it. Maybe for a short period of time, maybe for a medium period of time, who knows?
Yeah, I think that's one of those things that, they never really, it's never really explicitly said. It's just kind of implied, that when you're going through all your training, you go to these rural areas, and, a lot of the preceptors you're working with, even urban or rural, are like people that have been in their practice for, honestly, like, unless they're a new grad, like 10 plus years. So you're kind of seeing like a fully established practice, and it's all full go. And, like a lot of the stuff that they've got going for them, it's like, it's easy because like they've been there for 15, 20 years. But I don't think they necessarily show you that process of getting started and kind of the hassles and building your practice, kind of shaping your panel a little bit. And yeah, I mean, it was super sexy when you kind of showed up, and it'd be like, oh, hey, Tom, how you doing? How's Janie, how's Steph, how's Keegan doing? Like, oh, great. Like, everyone like, wow, this is just a conversation. Like, this is fun. But yeah, when you actually get out there and kind of understanding the permanence of it, it was a little bit tough for me to kind of see myself doing in the long term there.
So in terms of, you really appreciate the preventative side of medicine, that like an ounce of prevention's worth a pound of cure philosophy. Where do you foresee that going in the future? How do you plan to incorporate that into your practice and keep people well?
Yeah, it's kind of tough to say there, but that's I think that's the idea of family medicine, that was kind of sold to me throughout my training or even pre medicine. I always thought family medicine was just about kind of prevention because I was fortunate to have a doctor being like, hey, you need to keep exercising, you need to make sure you're eating your vegetables and do stuff like that. And even then, it's like the only reason I was at the doctor was because like, oh, my mom was having an issue, or my dad was having an issue. It's not like they just went there to get that advice, right? Um, but as I kind of go through my training and as now somebody who's working within the system, I think, with our Canadian model, the kind of the universal healthcare, the publicly funded system, I think, prevention really has to be the main focus now. If it's something to keep our system going, to keep it sustainable, we can't just keep seeing patients when they're already, a little brush fire turning into that forest fire, and we just kind of throw a med at them and say like, oh, this should hold you off for now. But if it doesn't, go to the emerge. And then, you kind of keep doing that, keep holding it under bay, but eventually it hits that peak. Whereas if we can find some ways to implement a little bit more of that prevention earlier in their lives, maybe even at the elementary school kind of stage, middle school, high school, kind of public classes and accessibility, I think that would be, in my mind, something that could definitely help kind of relieve a little bit of the burden on the system. But obviously, that's not going to work just quite quick as we need it. But that's something I think that we should be thinking about, hopefully, down the road.
It's a good point, right? Like we talk about all the demand and the burden on the healthcare system and how can we make it run more efficiently, but why not get intervening upstream of the problem, right? Like why not have a course in school for healthcare literacy, like just reducing the demand for healthcare problems by educating people and patients, right? Like I've heard a lot of people refer to, Western medicine sort of as sick care as opposed to health care because it's reactive, putting out fires, like you mentioned. Like, why not invest more in that health of the population up front?
I think like the big public health studies that have been shown of like, oh, exercise, exercise is good if we get that 30 to 50 minutes or 3 to 5 times a week. Like that really helps decrease uh, all these markers that can really lead to heart disease, cholesterol issues, diabetes, right? So the data is there. It's just that implementation. And I think working in obesity medicine, I'm sure you've seen some kind of moments that you're like, oh wow, like these are things that, we really can implement and do a better job of teaching, like coming from a nutrition background. Um, it's quite shocking to see the people that actually have the means to eat a lot healthier and kind of make those healthy choices not only for themselves but as role models for their kids, their grandkids. They just don't know. They're just saying like, oh yeah, like I like white bread because it's enriched with vitamins, so it's probably pretty good for me, right? So we go through about 2 loaves a day kind of thing, and you're like, oh wow, like there's a point of intervention that could have been made here at many stops down the way, and to get to this point right now. And it's quite surprising to see that. So just finding some ways, I think would be really, really important in the long term to kind of help alleviate some of this burden.
I think it would go a long way, right? Like just getting on top of the problem. I mean, from your perspective, then, is family medicine sustainable as it is currently? Are there anything like in broadly throwing this out to you, just in terms of all the like recent government changes and all the different things going on in the medical, political sphere? Like, how much of that do you think is getting at the root of the problem of people are not wanting to practice family medicine?
Yeah, I mean, they're definitely not incentivizing it. And again, this might be speaking for a lot of other people there, it's a really complex situation that I don't honestly know. And I know obviously with the negotiations going on right now with the government, it's a pretty precarious back and forth on kind of what's going to happen next. But I think as a kind of from the family medicine side of things, although I should fully disclose I don't really practice family medicine anymore. I think we're not quite being heard. The demands of the family physicians aren't quite being heard. And at the same time, I'm just curious about kind of, if the demands of the family medicine side are met, what are kind of going to be the changes on our end to make sure that that family medicine can be saved in the future? Like, how are we going to implement these changes and maybe this new funding to make sure that family medicine improves? That's that's kind of a gray area, and I honestly don't know. Do you have any kind
What
of
would
thoughts
it
on that?
take? What would it
Yeah,
take to get you back?
what would it take to get me back? Honestly, I kind of like working from the a preventative aspect. So I think if I had a way to kind of implement more prevention in a formal setting, I think they've always rolled out some interesting ideas. Like the PCN in theory was supposed to be a great model for prevention. You have all your specialists as you need, but even then, it ended up kind of being shifted into being used as, oh, your A1C is now 6.1. You're pre-diabetic. We better not let this get too far out of control now. Whereas it's just like, hey, like, how's it going? Like, oh, I noticed you're you're having some digestion issues. Maybe we should get you seen a dietitian to prevent you from getting to this point where you have high cholesterol that your family has a strong history of, kind of thing, right? So it was like the idea was there, but it just wasn't in practice ran quite implemented correctly, in my opinion.
So it wasn't like a money thing. It wasn't like a, I don't know. There's a lot of like single variant things that you can try and point to, but overall, it was just like the type of practice.
Yeah, yeah. I think one of the things that kind of popped up in my mind and like working in a lot of family medicine clinics, I just thought they were kind of outdated technology. It was kind of inefficient. And I think that's going to have to be something that really changes. I think we need to really start implementing and utilizing a lot of these uh, technologies that are available to us. Like, it's amazing how many, as a locum, I must have worked in 8 clinics, just kind of all around the Calgary area, southern Alberta, Yellowknife. And like some of these EMRs we're using were just like MS DOS, man. Like those big floppy disks, you basically just got to put them in there and just use it. It was crazy to see that this is how we're taking care of like our patients, and we're paying a lot of money to use these dinosaur EMRs. And it just made so much work, like I would use Wolf, for example, and it would crash like twice a day, and it'd be like you'd be sitting there taking a psych history, and it'd be like, okay, now that's down, and I can't give you your prescription, so I gotta go get my pen and paper and write this out. And there's just so many like outdated things. So I think family medicine needs to be if they really want to kind of start moving in that right direction, we have to start adopting change. Utilize good EMRs. Maybe doctors can start booking their own patients, take away some of that burden on your administrative staff that are already burning out and have to deal with the angry patients on the phones and answering messages and stuff. So yeah, I think we have to embrace technology. And I think that goes not only for family medicine, but for every field of medicine.
I was just having a talk. There's, I think, 40% of family practices in New Brunswick are on paper charts currently. And I thought that blew my mind. So, like, even as bad as it is here, we're still spoiled compared to much of the country.
Have you ever worked in a clinic with a paper chart?
No, I'd like when I was a kid, I'd go to the doctor and they had a paper chart, but never in my professional career have I, other than like in the ER. Like, I don't know why that's excusable, but yeah, in the ER, it's paper charts. That was really
Oh,
the only time.
good story about that, man. So when I started locuming up in the Airdrie area, they kind of the PCN in the area, they were kind enough to be like, hey, Dr. Sharma's in the area here. If you need a locum, please reach out. He'd be more than happy to kind of help you out. And this one guy kept like messaging me, really nice guy. He's like, hey, can you make these dates? I really need to do this to go see my family. And like, I had at some point I had so many locums, but I was like, oh, hey, like I got 2 weeks. I could kind of work it out with you. And, like you kind of just go there and you meet the person like a day or two before you start and kind of get a run of the clinic. And nicest man in the world, older doc, get there and it was paper charts. And I didn't know how to say no. I was like, oh no. So I was like, hey, yeah, for 2 weeks, like not a problem, man. Let's do it. Oh my God. What an experience. They didn't even have Wi-Fi in the clinic. So I couldn't even pull up Netcare, couldn't do anything. I was using my phone to try to get stuff. And it was just like, oh yeah, so what did you see him there? And then you have to read doctor writing. That's not your own terrible doctor writing. And it was just like, I can't believe medicine was practiced like that at any point. But yeah, it was definitely an experience. But yeah, 40%, that's quite shocking to hear that's still
Pretty
going
wild.
on. I think 2% is shocking.
Anything greater than 0 is just a terrible tragedy.
Yeah.
Your personal wellness tip before we wrap up here. What do you do? How do you actually keep yourself alive? What's the number one thing?
I think just being consistent in whatever you do. It's funny. I'll tell patients like, just kind of get them started. 3 to 5 days of exercise is a good goal to kind of work towards. But honestly, looking at humans throughout time, right? We are active creatures, and we got to be active every single day. It doesn't matter what you do, even if for 5-10 minutes, get that heart rate up. And just exercise every single day. And then number 2, just stay hydrated. At least there's no reason, unless you're in florid heart failure, that you shouldn't be drinking at least 2+ liters of water a day. Not coffee, not tea. But staying on top of your movement, just getting up and move, and then staying hydrated are like 2 of the easiest things that you can do that literally will improve your life in every single domain.
Okay, wise words. Thank you, Dr. Sharma, for joining us. Appreciate you taking the time.
No worries. Thanks for having me, Dr. Valrath. Appreciate it.